Runners, if you've been dealing with SI joint region pain and pain into the area of the high hamstring and none of your rehab is working, none of the treatments are working, but you've done everything that you've been told, there's a possibility you're missing something really simple, which is called referred pain from the TL junction facets of the spine. Now this is a picture of referred pain from the TL junction, thoracic lumbar junction, so midpoint. The facets are the joints of the spine on both sides. They're at every level, just particular to this level here. And you can look this up online. Just look up TL junction referred pain. So you can find these areas, these X's here, are not the areas of where the red are. The red are areas where people complain about pain most of the time. The deep red is more common, the lighter red is lesser so. But you can see that this one on the left here, this lower TL junction, because it's a region, there's a few levels in it. This one actually refers more to what we would call an SI joint pain. And I know a lot of runners out there have been dealing with SI joint pain and getting their adjustments or getting their mobilizations done or soft tissue work, and it's not really changing. There's a possibility that if that is so, that it's actually referred pain. The definition of referred pain is the pain is more present in an area that's not the source of the pain here. Now, if we look at the other side, we can see a higher level of that same region that refers even lower. This one refers down into the deep glute area. A lot of people will interpret this as high hamstring tendinopathy. In both of these scenarios too, you'll see that your MRI or X-ray will generally be pretty normal. And in the area of the high hamstring tendinopathy, in this scenario, you'd find out that generally speaking, this hamstring tendon will look very much like the other hamstring tendon, although the other one doesn't really hurt. Understanding referred pain is a big educational piece for a lot of people because it's hard to understand that pain can refer from one area even though it doesn't hurt in that one area. A good example is a heart attack. Most structures in the body can refer, including joints and muscles. I worked with someone just recently in our telehealth sessions. He was a runner. He'd been actually off his mileage quite a bit, but he was diagnosed with a high hamstring tendinopathy and he had some related lower back pain, which could have been the SI joint area in this too. So he had done a good hamstring protocol. He did his isometrics, he did his RDLs, he started deadlifting, he did all those things. But getting back into running or sprinting was very hard for him because every time he did it, it increased his symptoms again. So he was pretty frustrated about it. Luckily, there was an easy stretch and an exercise that we can do that actually made him feel a lot better in that moment with what he can do to duplicate it, but he still has to do more to actually get back on the trail again too. Before I show you those exercises that I did with him, let me explain about the TL junction here and what it typically presents as, because you can see it a lot on our telehealth sessions if someone has a keen eye for it. Now, a lot of times the story goes, a lot of people have old lower back pain or an old hip injury associated to it. And what they show is they actually have what we call like this kind of sway back or butt out type of scenario. And what this does is it puts them into a general extension pattern in the low back. It also drops their hips forward, creating what we call an anterior tilted pelvis. Any of these alone are not a big deal, but sometimes when we're considering performance, it's too much load on a certain structure. And if we dial this pelvis forward like so, this pops out, but also this bend point up here happens as well. And you can see there's a stiff bend point in me versus kind of being like so. So that aggressive bend point or loading of the posterior elements of the spine are called the facets, create the referral. So what we can do is we can reverse engineer those mechanics with some of our exercises and get more robustness for an anti-anterior tilt, which will help out with returning to running. Now, one of the simplest exercises I have people do is called a 3-month prone. It's from a series of exercises called DNS, Dynamic Neuromuscular Stabilization, that we use here at Performance Place. So although it could be considered like a general exercise you can do, there's actually nuances to it. And being able to see them on video actually does help quite a bit versus just talking about it. So what we see here is I'm in an anterior pelvic tilt, and what we know about this condition is that if I allow this to occur in the exercise, I will endorse the compensation. I will load the structures, and the person will probably do the exercise or the plank-ish type of exercise, and they'll feel their symptoms while doing it. Well, what we can do instead is, and I'm trying to put my head down here, but I know my mic's going to muffle. I'm going to go like this, but I won't because of the mic. And normally what we do is have people take their pubic bone, which is the bone underneath, kind of above the private parts, and you dent into the floor here. Now what most people do is they'll clench their butt cheeks. That's not what we want. We want them to dent the floor, but keep the butt cheeks dormant. And it generally makes the ab wall work a little bit harder. Keeping this in tension, we ask them if we can slide a piece of paper underneath the rib cage or belly area, right here, and hold that position without failing. We usually take them through a lot of reps with it. It's a very hard exercise, especially when the hands are on the forehead. And it shouldn't hurt. It should just feel like a deep wall activation. The second thing we can do is we can try to encourage decompression at those segments as well. And we use something called a puppy pose. And so it's going to be here, hands out, forehead on ground. Again, I have a mic, forehead on ground, and then you sit back. It's going to feel in a normal scenario like you're stretching your lats. If it's not right, you'll feel like your back, your SI joint's going to hurt. But the key giveaway with this, again, is that you're not responding to typical care for SI joint or high hamstring tendinopathy. So why keep doing it? Most people actually respond very well, and you're not going to believe this, nobody does. Usually within about 4 weeks. People feel much, much better in 4 weeks if we do everything right. I had a hamstring tear. I felt much, much better in 4 weeks because I did everything right, but you'll still not feel perfect. If you're not having success treating your SI joint or your high hamstring, consider referral from the TL junction. It's a high possibility. We've seen it a lot here at Performance Place. And if this video gave you an aha moment, please scroll down on YouTube and hit the thanks button. It'll help us know what videos you guys like. It'll keep our lights on. It'll keep us fed. And we'll keep doing these free videos for you on YouTube. And if you guys want help one-on-one, we have telehealth. It's in the description below. And we have a correlated video in the corner that you're going to love and you want to watch that. See you guys next time.